MMT Cervical Extension. Assist the patient to the prone position with the head off the end of the table. The arms are at the side. Stand to the side of the patient, supporting the head of the patient at the forehead. Passively take the neck through cervical extension by supporting the patient's head at the forehead with one hand and at the chin with the other hand. You are not assessing the infield. You are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to perform cervical extension. Stabilize the patient across the upper back. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include trunk extension that brings the shoulders off the mat and trunk rotation. The patient may also perform only capital extension. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient across the upper back. With one hand, apply resistance to the occiput and have your other hand placed beneath the overhanging head, prepared to support the head should it give way with the resistance. The resistance is applied in a downward direction. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in cervical extension and holds against maximum resistance. Grade 4, good. The patient completes full range of motion in cervical extension but breaks against strong to moderate resistance. Grade 3, fair. The patient completes full range of motion in cervical extension but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Assist the patient to the supine position. Make sure the head is supported by the table. The arms are positioned at the sides. The gravity-eliminated position of the therapist is to sit or stand at the end of the table facing the patient. Support the head with both your hands under the occiput. Instruct the patient to attempt cervical extension into the table. Grade 2, poor. The patient completes partial range of motion of cervical extension by pushing into your hands. For Grade 1, maintain the patient's head supported at the occiput. You must now palpate the cervical extensors by placing your fingers distal to the base of the occiput at the level of the cervical vertebrae. Again, ask the patient to attempt cervical extension. Grade 1, trace. Palpable contractile activity. Grade 0, no palpable contraction.